But I personally think that it's been relatively successful, the test and trace thing. That's what I think.
Yeah. I would agree with you, to be honest, because I think what you're saying is right, because if we look at the reason why it was created is obviously because to keep a track on the number of people that were getting in contact with COVID-19, and because it was spreading so quickly, and we were in the like first, second, and third wave, we needed to have statistics of how fast and rapidly it was spreading, who it was spreading to, and obviously a better idea of the geographical and the areas how it was spreading. So I think the track and trace system, the reason it was set out for was for those reasons, obviously to find out who's getting infected, how it's spreading, and then using that data for research purposes, and also to reduce the risk by alerting people, by tracking and then tracing and alerting people, okay, you've been in contact and you need to self-isolate. So I think if it was created for those reasons, definitely it has ticked all those boxes, and it has been useful, as you've said. So I agree with what you've saying. There will always be criticism about different applications, because obviously nothing comes with 100% guarantee that it's going to work 100% the way it's meant to. There's obviously going to be teething issues, teething problems, which were the issues when it pinged a lot of people. We heard about the pinging, where people were being pinged and said, "Oh, you've been in contact. You had to self-isolate." So there were a lot of people that had to go off, and it obviously affected a lot of companies, businesses, people's lives. Because if this app was telling you that you needed to self-isolate, then you couldn't go against it. There wasn't anything to override it. That's what I understand. So so obviously that was
Well, personally, I mean, I've got the app on my phone, and what it's done. It has never pinged me to say that I've been in contact with anybody with COVID. But what it's done that I really appreciate is the fact that it's warned me about certain places and certain locations. Like you go to a place, and then you get a ping on it says that this place is not really safe. Do you know what I mean? I've had that a few times to say that okay. There's a bit of a high concentration of COVID cases around this area and all that, and then I just check myself and I say, probably there's no point going to this place if it's not that important, that kind of thing. So at least it puts you on your toes, and it helps to, even if it goes a bit overboard, but then again it's a system. And we have to understand that it's got its flaws here and there. But overall, for me, generally, I think it's a good thing. It's done its job.
I think it has. It's unfortunate that there's obviously been criticism, and obviously the people are for and against it. But for anything, there's going to be criticism. But it has been a good thing. I agree with you. Yes, definitely it has. And I mean, companies, I mean, all the restaurants everywhere, I mean, when you go, they have the track and trace. Then they ask you. I mean, even in Scotland, when we were yesterday, up until we left, we had to do the track and trace wherever we went. So everywhere they're doing it. Just before we go on, you were asking about Scotland and about the mask being compulsory on the trains. We did actually go past in Waverley Centre yesterday, the train centre, and people were wearing masks. And Ferdy pointed out because he heard our show, and then he said, "No, you must let Opoku know that it's compulsory. You have to wear masks still." Okay. So there actually is boards signposted in the Waverley train station that you have to wear masks, and people were wearing masks.
Yeah. I went into Tesco yesterday with Bridget. Yeah. And when we got out of the car and got to the main, the entrance, then I remembered that I didn't have a mask. I had left my mask in the car. And so I said to Bridget, just hold on, let me just go and grab my mask. And then somebody just said to me, "Oh, you don't you're not obliged to wear a mask.
Oh, yeah.
And I just smiled, but I still went to get my mask. But when I went into Tesco, to be very honest and to be very fair, I can say about 99% of people were still wearing their masks, even though it's no more compulsory to do that.
Yeah.
But probably everybody was wearing their face masks. And I was thinking, oh, yeah. And people were hand sanitizing, spraying all the this thing on the trolley and all that. And I was thinking, people are still being careful and they're doing what they can not to spread it and also not to catch it.
Yeah.
So it's a good thing. I mean, I think the discipline is there now, some way, somehow. Of course, you'll have a few people who will not give a damn, just do what they want to do. Yeah.
I think so. So, I mean, to be honest, all over, people are still being quite sensible. A lot of people are still wearing masks, especially if you go into London. As I said, we went the other weekend and end of July, and that was, a lot of people were still wearing masks. So it's reassuring to see that people are wearing masks even on trains and in public spaces. And, yes, it isn't compulsory. There was Freedom Day, isn't it? 19th of July. So where it wasn't compulsory to wear a mask. But having said that, I think people are saying that they need, a lot of people are still willing to wear masks, which says something, isn't it?
It does. It does. And even with churches, I noticed that on Sunday I went to church.
Oh, lovely.
And it's the rules are still in place.
Yeah.
In the church I went to,
the
rules are still in place. Like every other pew is not occupied, so there's that social distancing, and it's compulsory to wear a mask before you get in. You hand sanitize, and when the pews are full, they're full. Nobody else goes in anymore. They will turn you away. But everybody understands. It's not like they're turning you away from worshiping or from your religious rights. It's just that the situation that, look, when the place is full, and you can't come in. And I thought that was brilliant. And I was told by the ushers that, well, these measures are still in place until they're comfortable enough and confident enough to sort of ease the rules. Still no singing in the churches, and still everybody's wearing their face masks. But everything went all right, just like it been for the past more than a year and a half now.
Wow.
Yeah.
So that must be nice anyway, to still be able to go into the church and still, be part of the service, isn't it? As opposed to...
it's amazing. And, of course, everybody's missing singing in church. I mean,
I can imagine you are definitely missing
and not sing, Everybody wants to sing. And sometimes when the organ is playing, you hear people singing under the umbrella like that, But hey, that's where we are at.
So why wouldn't they allow singing?
Well, it was part of the restrictions, probably because of I don't know, the spread of I don't know. It was part of, and it is still part of the restrictions in certain churches. You're not allowed to sing. So
that must be an experience quite different.
Very different. You can imagine going to church without singing.
Especially you not being able to sing.
Especially me. I know that. You know what I noticed? I just realized that yesterday we didn't even do the numbers at all.
I had the numbers and I was gonna say, but then you were trying to get off because it was quite late. It was already 7:45. But I had the numbers.
To be honest with you, that wasn't the reason. The reason was because I was so caught up in the conversations we were having. And then I realized, oh God, time's gone. So, I just said that.
I know we didn't do the numbers.
We'll push that to today and see what the numbers are like.
I've got the numbers. Go on.
Especially in the United Kingdom.
Yeah.
But another thing I wanted to ask, I probably should have warned you first. I should have asked you that we could research.
Yeah, exactly.
Why? There's a lot of borders that are open now.
Yeah.
All around the world, the borders open. There's still some shut, but it seems as if a lot of the African countries have closed their borders, land borders. I'm talking about. I'm not talking about air borders.
Yeah.
And I was wondering, why that is, because first of all, the economy, and number two, people are still coming in anyway.
Yeah.
By air and sea, and sometimes through illegal means, across land. So I was wondering.
It's because of the COVID, isn't it? It's because of COVID restrictions. Well, so it's always.
Yeah, definitely.
It's because they want to obviously curb the spread of COVID-19, because we know very early on when this pandemic started in Wuhan, China, because of the spread of people traveling, that's how we ended up having the first, second, and third wave. So, and it continued in a lot of countries like UK, USA, India, South Africa, lots of countries were affected. And now Australia is quite a big concern at the moment, which we can talk about. But yes, so it makes sense to close the borders, but at the same time, what you're saying is the economy is important. Yes, the economy is important, but then they're probably weighing the risk and benefits. Leaving the borders open, allowing it for foreign travel, or closing the borders.
I see.
Yeah. No. On the traveling, can I just say, we were talking about masks being compulsory when you are traveling. I spoke to someone who flew from Ireland, and they said that they had to wear masks on the flights to the UK. Okay. So from Ireland to the UK. So I think certain flights, obviously, you still have to wear masks, and other flights maybe not. I'm not.
Well, if you ask my advice, I would say that wearing of masks should still continue on airplanes, because they're very small environments, aren't they? They're not like big space. So right. Well, you talked about Australia, and that takes me to Australia. Yeah. And they're saying that Australians living overseas could be trapped in Australia if they return after the nation's government tightened its border rules without notice. And since March last year, the country has banned its citizens from leaving the country as part of its COVID strategy. The restriction has not previously applied to Australians who usually live in other countries. Yeah. But they will now need to apply for an exemption for outbound travel in line with rules for other Australians. This is quite strict, really, isn't it?
It's really strict, because when we were talking yesterday, I was supposed to mention about Australia because there were troops actually deployed in Sydney, and people. So they sent army into Sydney to help enforce COVID lockdown. So because of the Delta outbreak, which began in June, which produced about 3,000 infections and led to 9 deaths. So Australia is quite serious at the moment in terms of the way they're managing the pandemic. It reminds me a lot of like what happened in China, where the troops were just deployed and it was everything went into lockdown. So I don't know what your thoughts are about Australia, but it seems they're doing quite.
Well, I think it's very strict, and because if you are an Australian and you probably live in the UK and you go and visit, you cannot leave. You get trapped and all that, and that is serious. But then again, they have to do what they have to do to protect themselves and their citizens, don't they?
Yes, exactly. And I think we were reading when we spoke last week, I think about they attribute the rise in infections because of the lack of the rollout of the vaccines, which obviously they are now trying to implement. So,
Right, okay. What's the situation in France? Do we know?
So France, we know that France has obviously changed, the rules have changed in terms of UK travelers quarantine from France. So that's why a lot of people now will be traveling to France, because...
Including myself.
Yes. And I definitely am very tempted to go to France. So it's been a long time. And so I think a lot of people are going to be traveling to France. So they've obviously opened they've sort of relieved some of the restrictions.
So you don't have to quarantine when you come back. Yeah. Which is good. Yeah. And I mean, most of the time we go to France not for long periods, just for a weekend or just 2 or 3 days. So going to France for a couple of days and then coming back home and quarantine for 10 days, that is quite serious. That's why people don't want to go, So yeah,
exactly.
We'll see how it goes.
Yeah, can I just say, sorry.
Yeah.
So UK holiday makers facing vaccine passport chaos in France. So it seems that there's certain businesses in France that are not accepting just proof of vaccination. So they want a vaccine passport. So they're being turned away at restaurants.
What does that mean? What does that mean? Because if I've had
yeah.
They're not accepting the proof of vaccine.
Yeah, so they're not accepting proof of vaccine, and also even just the NHS codes are not being accepted. So in certain restaurants and so what they're saying is France extends health pass today. So rules for residents and tourists. A health pass is now required to go to restaurants, cafes, bars, including terraces, and to use long distance transport services. And to enter hospitals in non-emergency situation. So everyone over 18 and over in France must. So that was from yesterday, August 9, present a health pass sanitaire to enter public places, including cafes, restaurants, bars, those in shopping centres, health establishments, shopping centres, long-distance transport within France, culture and leisure spaces, communal spaces in hotels, so such as swimming pools and spas and restaurants, events at religious centers and conferences and wedding places. So everywhere, basically.
Really?
So children 12 to 17 will also have to use a health pass from the 30th of September.
So how do you get the health pass then?
Yeah, so I'm coming to that, Judy. I'm coming to that, yes. So it's part of the new French law requiring people to prove COVID status. What is the French health pass? It is a pass. It's not a document. It's a way, and it's not a document but a way to prove you do not have COVID-19. So it's not restricted to vaccination and demonstrating your health pass on entry. So you must show which means you must show proof of vaccination, a negative COVID test or negative or having been positive within 11 days to 6 months before entering. So these documents can be shown in a paper format digitally or through the phone application. So they've got their own application that you need to download. It's TOUS, so TOUS, NTANTI COVID, and there'll be a QR code attached to the document. So you need proof of your vaccine. So you need to have to download this to get your health pass. Then you need to download your documents, which is your proof of your vaccine, negative COVID test within the 48 hours. And then
now, whilst you're talking to me, if you just give me the
website, the thing.
If you spell it for me again, the app.
Yeah, so you need to the phone app is TOUS. It's TOUS. ANTI.
COVID app.
Yeah. And there'll be a QR code. So
I see
so
that.
actually everywhere.
It's an app store actually, so you can it's on the app store or the Apple thingy. You can download
so
it.
I think probably like what France is doing, it sounds like every country will probably have their own, because I think what they're saying is like even because when you go to the NHS, like when I've gone and you've gone, you've got your proof, you've got your dates of your vaccine, and you can get your COVID pass, isn't it? So that you can use it.
Yeah, you can on the NHS app.
So we are able to use it here in the UK, but it seems obviously France is not accepting that.
But on the NHS app, it gives you an option. It gives you because there are two options. It says domestic and something else. So I've only used it domestically, so I haven't tried. So I don't know what that's. But I'll check it out. You know me. I will follow through.
Have a look. With all your traveling. So it seems like everywhere you need it in France. So you need it in cinemas, museums, theaters, libraries, theme parks, indoor facilities, and public pools, places of worship, conference halls, auditoriums, stadiums, arcades, casinos, zoos, fairgrounds, nightclubs, shopping centers, restaurants, long distance transport, hospitals, and even for campsites and holiday parks with swimming and entertainment Yeah, so it seems
Wow.
that everywhere you would need it, and
I'm gonna have to download it in a minute then.
yeah. So what happens if I refuse to show my pass sanitario, your pass? It says that the establishment can refuse to serve you, and there is a fine of 135 euros for anyone caught using a fake certificate.
Oh my God.
Yeah.
I see. Anyway.
So everywhere, even like if it's outside, just sitting. I mean, so they're basically anywhere in France. Because I mean, when you go to France, you know what you're going to be doing as a holiday maker. You're going to be traveling, going to the, going to the cafes, Eiffel Tower, or just going to museums, or the cathedrals or churches, or it's so it's virtually impossible to be in France.
I told you I have to go to Paris, so it's anytime soon, and it's mainly for work, so I'll have to check with my hosts if I needed to enter the building and all that. So
can I just say two more things? Two more things before we do the numbers. I know we want to.
Go on. Yeah.
So when will the pass needed until? So it'll be at least until the 15th of November. So if you are planning to go to Paris before the 15th, then you will need it.
Definitely before that,
yeah. Do I still need a mask if I have a pass? So the law states that the obligation to wear a mask does not apply to people who have accessed establishments, public places, services, and events via the use of a valid health pass. The only exception is on public transport, such as TGVs, buses, and planes. Masks will be required in shopping centres, except those where local prefect has required health passes. So we can probably talk about that more tomorrow, but it's quite a lot, actually, a lot of information.
This is really interesting. I'll have to research into it. So thanks for bringing that up. Yeah, that's fantastic.
I know that only came up yesterday, and I think we were talking a lot about Scotland yesterday because we were in Scotland. But hopefully when you go to Paris, you can tell us more about... I'm getting very envious now. I wish I was going to Paris soon.
No worries, you can come with me.
Definitely. I'm getting on that. I'm definitely going with.
Yeah. Well, I'm looking forward to going because Paris has always been my city, but at the same time, there's this slight, I don't know what's going to happen. We're going to ask questions. Where's your pass? Where's this and that?
Sounds like it's something like that, isn't it?
Yeah. We'll sort all that out before we get out.
Yeah.
So right. Okay, we've only got 6 more minutes, and let's do the numbers today.
Sure. So the coronavirus cases, so as of today, we are looking at the 10th of August, 204,158,000.
Can you imagine? 204 million now.
Yeah, I know. Yeah. It's just reading it out. It's overwhelming. Yeah, 204,158,115 positive cases. Total number of deaths is 4,316,468. That's a lot. That's really a lot.
It is a lot. It's
a lot. And to think we like a year and a half on and we still haven't ended, So let's see. We have to be optimistic. Total recovered 183,352,007 that have recovered. And in terms of the top 5, number 1 is USA with 36,780,480 positive cases, with 633,799 deaths. India number 2 with 31,998 1,158 positive cases, so quite a lot in India. Still rising with 428,715 deaths. Brazil number 3 with 20,178,143 positive cases, with 567,707 deaths. And Russia number 4 with 6,469,910 positive cases, with 165,650 deaths. France number 5 with 6,469,000. France is 6,310 1,933 positive cases with 112,288. Sorry, France is number 5. Russia is number 4. That's what I was reading. 649,469,910 in Russia. They're number 4 in the world with 165,650 deaths. So you can see why France, the restrictions are so strict. You know, they're taking it very serious. Number 6 is obviously UK with 6,094,243 positive cases with 130,357 deaths. South Africa, number 17 with 2 million.
South Africa's gone down, hasn't it?
It has, yeah. With 2,540,222 positive cases with 75,012 deaths. And Ghana, quite low down still.
Where's Ghana now?
Ghana's 133, yeah, so it's also moved further down.
103, it's gone way down now.
Way down. 108,226 positive cases with 874 deaths. And England, UK, the numbers are still actually going up with the number of positive cases. Last 24 hours was 25,161 with 37 new deaths. And yesterday was 27,335 new cases with 39 new deaths. So there are still some deaths, obviously. People are still being urged to get vaccinated. And as we spoke about yesterday, they're now urging pregnant women and also younger children and the more vulnerable ones in the 12 to 18 bracket age group to get vaccinated. So so watch the space. Let's spread the love and not the virus. And
absolutely.
Thank you so much for having me today. Just to say a shout out, happy birthday. I think it's my cousin Kieran's birthday. You met my aunt and uncle at Shreya's party, Anusi and Ken. So it's their son, Kieran. So happy birthday to him.
Happy birthday, Kieran.
Yeah.
And thank you so very much for joining us this morning. I mean, I know you must be tired. You got home after midnight.
No, I'm good. I had a good rest.
And all that. And you still managed to get up and join us this morning to bring us this amazing information on COVID and everything. Yeah. Thank you so much. We are so grateful to you. And of course, your family, your husband and children for being very accommodative and allowing their mom and wife to get on my show every morning.
I think they love it. I'm out of there. I'm not there to trouble them during this time. But no, I'm just joking. But
I understand. I know where you're coming from. All the best, Dr. Seshni, and we'll see you tomorrow.
Have a lovely day. See you tomorrow. Have a lovely day as well. Lots of love to everyone. Bye.
Bye. So it's 7:30 and